Hi, good afternoon, good morning, Dr. Rob Silverman. I am here alone. We're having some interesting technical difficulties. Just wanted to see if Mr. Buckler could hear me.
No.
Nobody could hear me. So what I'm going to do is I'm going to record. You can't hear me. There's nobody else there yet. We're a little early. And let's see if we can record. What do you say?
Yeah, it's recorded, so go for it.
Go for it.
But how are they going to hear you?
Yeah.
He just can't hear me. We'll cut this portion. He can't. Everybody else can hear me. That nobody's there yet. I don't know. We're gonna find out if it's gonna be done with.
Well, ask the attendee if they can hear you.
There's an attendee here. If they're just an attendee who popped up, can you let me know? Give me a thumbs up if you can hear me. We're gonna write a message to them. Because if they can't hear me, it means it's not recording, and we may have to redo it another time then, because if they can't hear me, all they're going to do is see the slides.
Yeah. Let me email him.
And it's Diego, if you know him. Diego Cochetti. Cochetti, excuse me. He's muted, so I'm gonna unmute him. Can't say he's self-muted. Diego, can you hear me? Yeah, we'll do it again if they can't hear me. Just so you know, this has never happened before, so it's all good. So you have two options if we can't fix this. I can pre-record it and you can play it, or we can try again next Thursday.
I can hear you. I've just turned the audio on my computer, so if you maybe want to say if anyone's
having an issue, make sure that they turn the audio on.
There's only Diego, so I'm going to get off the phone since you can hear me. So you're there, Rob?
Yeah, I'm here.
Great. Okay, so right now we only have Diego, but at least we solved the issue. So why don't you start the time? It's 8:03, so you know what to cut, and
Yeah,
we'll pick
cool.
top. But I think you have to tell them that they have to take the audio. I mean, if you can hear me, at least the recording will be there, so that'll work.
Yeah, fine. Yeah, fire away, Rob.
All right, terrific. Good morning, good afternoon, everyone. How are you? We've made it through a little technical difficulty. So happy to be here talking about functional medicine immunity in extraordinary times. So for me, let's just dive right in. With the advent of new research and management options surrounding the viral pandemic, many practitioners are now truly deciding how to navigate the best direction to take with their patients. As this pandemic continues, patients need additional help from clinicians to continue to modify their lifestyle, dietary risk factors, and improve their immune defenses. They need support in getting chronic inflammation and autoimmune conditions under control, moving towards a healthier weight, or at least avoiding additional weight gain, improving their diet, and improving their fitness through increased physical activity. These long-term goals are too late for the current pandemic's first wave, but later waves and new pandemic unfortunately threaten. Remember, we're trying to avoid it. We may have had it. And of course, we have the infamous vaccine. But the takeaway here is by helping your patients understand how to improve their immunity and reduce their risk, you can give them tools to enhance their ongoing health. So we're going to discuss how to navigate through the multiple phases of the pandemic, and I'm going to share some leading edge protocols to improve patient outcomes. So like I said, let's just get right in. There's one of my favorites, Bruce Lee with his son, Brandon. And he said, real living is living for others. And without question, that's a great quote, because right now, that should be every practitioner's mantra. So COVID-19, pre-existing inflammation, and that's something that I've always talked about in the light of, I'm a big proponent of managing and modulating inflammation. But let's take a look at the data. 94 to 97% of people who died from COVID and hospitalized were pre-inflamed. So they were sick before it. So it's really not the virus. It's truly from the host. So in the idea, the article came from America. America is pre-inflamed. Again, your guys' numbers, meaning your guys, in the UK, are not that far off of where we are. We're a little ahead of you, and I'm not saying that we deserve a medal for being a little heavier and sicker than you, but you're not that far behind. So we do know that the virus doesn't kill people. It's the body's response to the virus, or immune response, that does. 75% of Americans are overweight or obese, and 42% of Americans are just purely obese. Unfortunately, 12% are metabolically healthy, with 20 to 40% of the normal weight. People who are normal weight are also metabolically unhealthy. So when you look at that number of 12% metabolically healthy, if you were to look at 30 patients in one day, only 4 walking into your office, in theory, would be metabolically healthy. That obviously poses a health issue. We all have, or in this study, these people had too much visceral fat. Just did a webinar yesterday, mentioned visceral fat, and it popped up like you wouldn't believe. Visceral fat protocols. What do we do? How do we get rid of it? What is it really? Well, visceral, there's 2 types of fat. There's that superficial fat, that's that pinch and inch that you see all the time. And then there's that visceral fat. Visceral fat is fat over the viscera. That fat over the viscera can infiltrate different organs, pancreas, stomach, liver, etc., and pose a lot of damaging issues to those organs. That visceral fat is also most inflammatory and most deleterious to people's overall health. Visceral fat takes a long time to get rid of, and many tests don't incorporate an evaluation of visceral fat. So I think for a later date that we may do a follow-up, maybe video, really going through visceral fat and protocols for that. Now, with that being said, visceral fat suppresses your immune system. Also, with this pre-existing inflammation, people shed the virus slower. Your body doesn't respond. Your immune system isn't as potent. And when your immune system is slower, it slows your response even to the vaccine, because the whole purpose of the mRNA vaccine, for those who are taking it, you want to get an antibody response, so you have your soldiers in place to protect against onslaught. You're not producing enough antibodies. However, if you adhere to the changes that Rob and I talk about, you can make changes in a matter of days or weeks to change your life and your health outcomes around. So obesity and diabetes are comorbidities of COVID-19. That should not be a newsflash. The bottom line is that acute viral infection results in an ACE2 downregulation. Now, fat cells have more ACE2 receptor sites than any other part of the body. With that being covered, the appearance of bacteria, here's a clinical gem, in the lungs of obese and diabetic patients promotes interactions between the viral and bacterial pathogens. So this is a really great segue. I wish I had an hour to talk about this, because here we have the idea of the gut to lung axis. And as everybody knows, I believe that the gut is the epicenter of your health. It's where your macro and micronutrients are absorbed. Your gut and your lung have a bidirectional communication. Your gut has a bidirectional communication with multiple organs. But obesity and diabetes, to get back to the title, lead you down a path of having more susceptibility to COVID-19 and many other health conditions. This study really showed that extra pounds may raise the risk of COVID-19. Obese patients, just to piggyback on what we said earlier, become more dangerously ill from COVID-19. The CDC made specific suggestions. The healthy changes they recommend on a daily basis are as follows. You should make healthy food choices. You should make positive choices about physical activity and include some physical activity almost daily, and of course, get sufficient sleep. High blood sugar raises the death rate in those even without diabetes. So many people say, well, I like to follow my diet for 6 days, but on Sunday I go for it. Not really going to lead you down a good health outcome. Research was as follows. High blood sugar levels were correlated with COVID-19 mortality. Even patients with no history of diabetes. So using an early blood sugar screen would be a great thing to enable people to understand that they're a little more susceptible to COVID-19. This study showed there were over 11,000 positive patients, about 2,300 died of COVID-19. 41% of those had high blood sugar levels versus 15.7% of normal levels. This is directly rated at the UK and England. 61 million medical records in the UK. I know you guys have, last time I looked, about 67 million in your population. 30% of COVID-19 patients died with diabetes, 3 times the risk, or at least 3 times higher risk with those who had type 1 diabetes versus 2 times a higher risk versus type 2 than those without diabetes. So what you're really seeing is type 2, big increase in death and issues with COVID. Type 1, even more so. Interesting, diabetes was noted as an underlying condition 4 out of 10 patients. There's a direct diabetes to obesity link with the mortality rate of COVID-19. Here we're looking at the effects of obesity on inflammatory cytokine production and insulin resistance. This PowerPoint really illustrates quite nicely how that if you have too much adipose tissue and you've got your increased saturated fat, you have increased free fatty acids, your ratios of TH1, TH2 are off, M1 and M2 are off, you're seeing this increased adipose tissue is leading you down a path of inflammatory cytokines. Now there's 17 cytokines, well, there's 17 different interleukins, but cytokines are typically, not all, but virtually all of them are inflammatory. These inflammatory cytokines are released, increasing your incidence of insulin resistance. Both of these together lead you once again down a path of failing health. So here's the vicious cycle between COVID-19 and its comorbidities. Aging and comorbidities like lung, cardiovascular, kidney, and metabolic disease are characterized by sympathetic overactivity, which may exert detrimental effects on lungs, heart, vessels, kidney, metabolism, and or immune system of COVID-19 patients. COVID-19 may furtherly increase sympathetic discharge through hypoxia, ACE1, ACE2 imbalance, immune inflammatory factors, and emotional distress. So the schematic representation here of the process used by the host immune system to combat COVID-19. The antigen presenting cells, those are dendrite and macrophages, present the virus to the naive Th cells and stimulate the adaptive immune system. T cells also signal monocytes and macrophages to attract them to the infection site where they release chemokines. Toll-like receptors present on an antigen-presenting cells, recognizing specific receptors on the virus and secrete inflammatory markers in the innate immune system response. Therefore, mast cells activated by the pathogen release pro-inflammatory markers, protease, and histamines. These are all upregulating inflammatory markers. Here's a great little study that just came out in Gut. This is an article I would strongly recommend everybody on this webinar, whether you're live or Memorex, read. It talks about the gut microbiota composition reflecting disease, severity, and dysfunction. So it was a 2-hospital study. Blood and stool samples were taken, 100 COVID positive patients with 78 healthy control patients. The concentration of inflammatory cytokines and blood markers were measured from the plasma. Essentially, what you saw was the gut microbiota composition significantly altered in patients with COVID-19 versus control. So it's really getting back to the statement that I like to say a lot, in that 80% of your immune cells are in your gut. It kind of makes sense that the ecosystem, your signaling system in your gut, would be adversely affected if you've got this novel virulent virus. So when you take a look, the gut commensals, and gut commensals are people or bacteria that can live, or organisms that can live in the gut happily and suffice itself on the food and not damage any organs. You'll notice that the gut commensals were decreased. However, you can couple that with elevated concentrations via serum of cytokine C-reactive protein, lactate dehydrogenase, aspartate aminotransferase, and gamma glutamyl transferase. The takeaway here is specific microbiota patterns were correlating with the disease severity, and those bacterial imbalances could account for what we're now calling long COVID or the long hauler syndrome. Takeaway here once again in the conclusion, and we're really delving into this article because I thought it was with a hallmark moment. The associations essentially between the gut microbiota composition, cytokine levels, inflammatory markers, and COVID-19 truly suggested that the gut was a modulating host of immune responses. For gut microbiota dysbiosis, could actually contribute to persistent systems and symptoms, highlighting the need to understand how the gut microorganisms are involved in inflammation in COVID-19. So even after you're going to have gut dysbiosis, everybody who's been affected by COVID would probably benefit from a good gut restoration, microbiome restoration program. So the summary to the article was as follows. Findings suggested that depletion of immunomodulatory gut microorganisms contributed to severe COVID-19 disease. The dysbiotic gut microbiota that persisted after disease resolution could be a factor in developing persistent symptoms and/or multi-system inflammation syndromes that occur in some patients after clearing the virus. Bolstering of beneficial gut species depleted in COVID-19 could serve as a novel avenue to mitigate severe disease, underscoring the importance of managing gut's microbiota during and after COVID-19. So they looked at a cross-section, H1N1, and I'm going to speed up a little because, you know, I do want to get to some questions and I want to keep this in an hour or less for once. They did a cross-sectional study between COVID-19, H1N1, and healthy controls. Essentially, when you compared H1N1 and COVID and healthy controls, here's what you found with the healthy controls and COVID-19. The COVID-19 patients had significantly reduced bacterial diversity. They significantly had higher relative abundance of opportunistic pathogens, lower relative abundance of beneficial symbionts. When you compared COVID-19 patients with H1N1, the H1N1, or the COVID-19, they had a lower diversity and a different overall microbial composition. The conclusion was the gut microbial signature of patients with COVID-19 is very different than H1N1 patients and healthy controls. So the study actually suggested the potential value of the gut microbiota as a diagnostic biomarker and a therapeutic target for COVID-19. Alterations in the microbiota of patients with COVID-19 during the time of hospitalization. Once again, piggybacking on what we said before, fecal microbiota alterations are associated with fecal levels of SARS-CoV-2 and COVID-19 severity. So the strategies to alter intestinal microbiota might reduce disease severity. What's most interesting is that I found this article, and you know, to talk about vitamin D in the immune system, I mean, even Dr. Anthony Fauci, which was a breakthrough, we're happy about that, spoke about vitamin D, he spoke about zinc, etc. But let's really look what vitamin D does in reference to its immune defense in the gut. Increased vitamin D levels shown positive changes on the composition of the gut microbiome. It also shows positive effects on autoimmunity by positively changing the microbiome in autoimmune patients. It supports intestinal and immune cell defenses at the gut immune interface, has positive effect on maintaining tight junction structure. The conclusion was that it was evident that immune system and the microbiome are interconnected and that vitamin D is a critical player in this dynamic. Really good slide that really vivifies what's going on in the gut with vitamin D. So the model of interactions between genetics, gut integrity, microbiome, vitamin D deficiency. The genetic predisposition can influence vitamin D activity, integrity of gut barrier, and basal level of immune function. Low vitamin D increases the permeability of the gut barrier and heightens immune activity. Furthermore, lower vitamin D and permeability of the gut alter the microbiome composition and the ability of microbes to translocate across the intestinal epithelium, leading to interaction with the host immune system. Ultimately, immune system activation contributes to autoimmunity. So vitamin D plays a vital role in supplementation as a gut microbiota modifier. Now, this is, for me, this is one of my favorite sides. So here what we're doing is we're really digging in the illustration of how the SARS-CoV-2 infection and its association with the lung, gut, brain. So for me, I would have called it gut, lung, brain axis and microbiome dysbiosis. This is really exemplifying how this virus is so unique in that it can affect and communicate through our body, and that gut is again the center point of the communication, and now we're seeing the gut to lung axis playing a major role. Just remember pulmonary epithelial permeability. You've got leaky gut, you've got leaky brain, you can also have leaky lung. So when you look at the idea of leaky lung, remember the lungs also have tight junctions. Cordon proteins keep pulmonary barriers intact. These cordon are sensitive to chemical irritants or pro-oxidants. Chronic inflammation breaks down the barrier. L-glutathione is critical to protect against the lung damage. So once again, as I shared with you, let's look at my 7R action plan. Let's go through this in an epigrammatic fashion. The 7 R's are very simply reset your lifestyle and your diet. 2, remove unwanted pathogens. 3, replace needed digestive enzymes and stomach acids. 4, regenerate damaged intestinal mucosal. 5, re-inoculate with quality pre and probiotics. 6, reintroduce with certain foods and with that you removed in step 2. So essentially when you remove, to take a step back and try and help you unpack this a little bit, when you remove the pathogens, you're removing foods like food allergies, food intolerances, and most commonly, which is most popular, food sensitivities. Food allergies really occur in only a few percentage of the population, fortunately. Food intolerances, 5 to 10%. Food sensitivities is approximately 25%. So now your opportunity after fixing the ecosystem and the gut barriers, because my biggest thing is to detect the environment and to detect the barrier, you would then reintroduce certain foods. And then when you have successfully, you would look to retain your health and your GI integrity. So let's go through this 7-step action plan. Let's look at the particular protocol, the supplements. And if you get anything from today, here's something that you can start with your patients tomorrow. So Aspergillosis yeast, that functions like a probiotic. Medium chain triglycerides, which I really like. They're not only great brain health, they've also shown to help the ecosystem in the gut. Magnesium glycinate, most people are magnesium deficient. Spectrum AR is an oregano oil. That oregano oil is critical to take away the upper respiratory issues. This would be great if you thought somebody had a lung dysbiosis. Spectrum BR, berberine, bowel dysbiosis, your train wreck patient. Garlic, your own natural antibiotic. Garlic really gives you that ability to mimic antimicrobial, antifungal, and antibacterial properties. Dynamic detox is a full composite medical food that allows you to take care of phase 1, phase 2, and phase 3 in the body. To detox is during the remove phase is very unique to my program because I'm a big proponent of detoxing environmental toxins because they put a tremendous burden on both the gut and the liver. Digestive Complete. Digestive Complete, I call a 3-in-1 product. That Digestive Complete is great in that it allows for hydrochloric acid production. It's funny, I just got a couple of people here in my office. I'm sorry for taking a second. They put their hands up like they all know Digestive Complete is a 3-in-1. It's a big deal. Digestive Complete allows you for stomach acid, pancreatic enzymes, and also allows you to increase your bile flow, which is actually a hidden gem and a critical element. Continue with that dynamic GI integrity and GI restore. I mix them together. The names really explain what they do. One has specific nutrients to allow for the integrity of the gut. The restore allows you to restore what's going on in your ecosystem in the gut. Pro-resolving mediators, my takeaway there is they allow for the resolution of inflammation. Omega-3 fatty acids are great, we're good for overall health. They're a staple in a person's supplemental career. They also blunt inflammatory signals in the gut. Alpha lipoic acid has been shown to be positive with specific conditions like IBS, and you wouldn't really want to go anywhere without your D3 5000 and your K2. When you go to your reinoculation, your Spore Probio, great formula. That's a 3-in-1 formula also, in that it's got your Spore Probiotic. Your Spore Probiotic is protected. It's an endospore. It gets to the destination. It's got a great prebiotics. Prebiotics with probiotics are critical. Prebiotics feed the probiotics, which allow you to have a positive residual postbiotic. Postbiotic is your tombstone. It's what you've left that resonates your value to the environment. And you have the option of ultrabiotic daily multi-strain. It's 7 strains, so it'll give you a full spectrum composite of upper and lower bacteria. Now you can reintroduce. As I've taken some time, I just believe that any component of this will really help your patients. You can avoid specific foods like gluten, dairy, fried foods in any test or any food that you're allergic or still sensitive to. And last but not least, what do you do when the patient's reached a goal where they want to retain their health? Well, make sure you give them proper diet, lifestyle, and mindset changes. Allow them to have a GI restore, because why not keep your gut in good health since 80% of your immune cells are in your gut? A good probiotic, there's your choices. A dynamic greens is a great choice because the greens allows you to get up to 20 fruits and vegetables. It's hard to eat them daily no matter what diet you embark on. And why not a dynamic multi-collagen renew? It's much cheaper than getting bone broth. Bone broth is great. The dynamic multi-collagen renew gives you collagens type 1, 2, 3, 5, 10, and even 15. So it's doing skin, hair, and nails, cartilage, and all tendons. So let's get back into the post-COVID-19 syndrome. You need to improve your mitochondrial function because COVID-19 is a vampire to the energy. It drains the battery of the mitochondria and it's increasing fatigue. So you want to improve mitochondrial function by decreasing fatigue. Here's your protocol. I would use anything that makes NAD. NMN makes NAD. You have your B vitamins, your coenzyme Q10, your carnitine, your alpha lipoic acid, your master antioxidant, glutathione, your zinc, your selenium, your vitamin C and E. And to immune activate your mushrooms, reishi, maitake, lion's mane, changa, and of course, shiitake mushrooms. Lifestyle, diet, low glycemic carbs, no processed carbs, good fats and amino acids, sleep and exercise. Low-level laser. Low-level laser allows you to have electromagnetic transfer of energy. Detox, remove toxins. So for my long haulers that are post-COVID-19, they're defined as a presence of symptoms extending beyond 3 weeks in the initial start of symptoms, and COVID-19 extending beyond 12 weeks. In an Italian study, 143 patients were discharged from the hospital. 18 patients, about 13%, were completely free of symptoms after a 60-day onset. So one of the biggest decisions you have to make if you get COVID-19 is what are you going to do if you become a long hauler and how to avoid that? Because that for me is the biggest concern. It's not just getting the flu, being sick for a week or two and avoiding everybody. It's what kind of residual detrimental effect it does to your body via the ACE2 receptor sites. So some of the common symptoms are fatigue, dyspnea, joint and chest pain, organ dysfunction in the heart, lungs, and the brain. Complications from a consequence of direct tissue invasion by the virus is people have a profound inflammation or profound increase in inflammation. The cytokine storm has been documented. and related immune system damage. People said they're starting to get sick. That autoimmunity poses an issue. There was an article in Frontiers that took or mimicked monoclonal antibodies, put them on different structures in the body, and found 50% of the time people were having autoimmune responses. So when you make your decisions on your route to go, put this all in. When people say, well, I don't know, my immune system's pretty good, it's never good enough. Let's do all these things to avoid trying to contract COVID. And if we do, all the post issues. Cardiovascular, myocardial injury increases troponin. Troponin is an enzyme that you can test for myocardial inflammation, myocarditis, cardiac arrhythmia. In a German study of 100 patients post-COVID-19, 70 days after diagnosis, this is very disconcerting. Cardiac involvement was 78% and myocardial inflammation was 60%. There was a study that came out that talked about with Division I football players, stout, strong, perfect physical specimens typically, and they had cardiac problems after contracting COVID-19. Cardiovascular, 26 competitive college athletes. Here we go. Non-hospitalized, majority without symptoms. 46% of them had an evidence of myocarditis. Pulmonary and neurological, 55 patients, 3 months after discharge. 64% had persistent symptoms. 71% had interstitial thickening and the evidence of fibrosis. Neurological, viruses can penetrate the brain via specific pathways and a direct invasion of the olfactory nerve. So neurological, the olfactory nerve, we know that affects the central nervous system. In that central nervous system, what we saw was loss of sense and smell. Very common. Some other neurological symptoms that come to the top of mind are headaches, vertigo, loss of sense of smell, insomnia, mood swings, and brain fog. So SARS-CoV-2, we actually don't have to go through the whole thing. The ACE2 regulation leads you down a path of the hijacking of the host mitochondria. The conclusion of the study with the hijacking of the host mitochondria is as follows. Observations suggest that a distinct localization of viral RNA and proteins in mitochondria play an essential role in the SARS-CoV-2 pathogenesis. Long haulers and the vagus nerve, shortness of breath in the long hauler syndrome. Dr. Fauci said there's no detectable organ damage group having post-viral syndrome called the idea, he called it vagal neuropathy. So it was previously known as chronic fatigue syndrome. The real problem is that vocal cords close instead of opening and there's shortness of breath. That's the vagus nerve. Most hospitalizations in COVID-19 patients have symptoms after 6 months. Truly, truly distressing. 76% of cohort COVID-19 patients still had at least one symptom 6 months after discharge from the hospital. The long COVID, again, here are some of the symptoms: fever, dry cough, fatigue, muscle aches, chest pain, and heart palpitations. The study included 1,700 patients. The follow-up appointment was 186 days after discharge. The most common symptom, fatigue, 63%. I can tell you with my patients that have had COVID, the one thing they complain about almost to a T is the idea of they all are fatigued. So the key takeaway, those who completed the lung function test, researchers found the correlation between the severity of the person's initial COVID-19 infection and their lung function at follow-up. So for me, I was very excited. I'm a big proponent of activating the vagus nerve because it's starting to be shown that it can lower the COVID-19 risk. Loss of autonomic nervous system balance can lead to an increased inflammation. Vagus nerve stimulation acts like a brake on the stress in all of its immune stoking effects in the body. COVID-19 is also shown to enter the brain. No real surprise. The spike protein of SARS-CoV-2 can pass through the blood-brain barrier. The protein can cause the brain to release cytokines and spark neuroinflammation. This could all lead to brain fog, cognitive issues, fatigue for patients infected with COVID-19. Piggybacking on what we said earlier, this is very data-driven. This is all in the last 3 months. I spent a lot of time getting this prepared for everybody here to give you the most up-to-date data. 6 patients using a specialized MRI. COVID-19 patients with neurological symptoms show some metabolic disturbances in the brain as those who suffered oxygen deprivation. Also, patients showed white matter abnormalities. SARS-CoV-2 in neurons in a 2021 study showed it may damage brain tissue. COVID-19 is shown to affect the frontal lobe of the brain. 15 to 25% of patients with COVID-19 may experience neurological symptoms, headaches, confusion, delirium, impaired consciousness. The study identified diffuse slowing in the background electrical activity in the whole brain in 70% of the patients. COVID-19 also makes tinnitus worse. That's also shown hearing loss could be a long COVID symptom or long haulers. They were calling it long COVID, long haulers, etc. 40% of those displaying COVID-19 symptoms simultaneously experienced worsening of tinnitus. Loss of smell, no surprise. Interesting, the MRI data reveals a transient edema of the olfactory clefts. In 20 patients, 19 out of 20 had a complete obstruction. 1 month later, 7 out of 20 had an obstruction. Control patients, those who did not have, obviously, COVID-19, had no obstruction. So now we're understanding that swelling poses an issue. COVID-19, children and antibodies. So what's very interesting is that children infected with coronavirus produce weaker antibodies and fewer types of them than adults do. These weaker immune responses in children may paradoxically indicate that they vanquish the virus before a chance to wreak havoc in the body. So their immune system is moving quicker. It really explains why children are spared severe COVID-19 and they're less likely to spread the virus. Children make primarily IgG antibodies. Adults make this whole plethora of different kinds of antibodies. So COVID-19 and autoimmunity. Most interesting here is the B cells in the germinal cells have checkpoints that prevent the generation of autoreactive B cells. Extrafollicular are capable of somatic hypermutation that can lead to autoreactive cell activations. Let me unpack that a little. 52 patients with COVID-19, 44% had a positive ANA. 59% of ANA patients had at least one other positive autoreactive antibody. 70% of patients had a high C-reactive group showed or ANA or RF elevation. Robust neutralizing antibodies to SARS-CoV-2 infection. Just let's look at the takeaways. More than 90% were strong enough to neutralize the virus. The vast majority of infected mild to moderate patients mount a robust antibody for at least 5 months. So that we're getting the time frame. But the question is, what do we do after 5 months? This antibody really does respond and correlates to the ability to neutralize virus. We've had this in America, it's really been talked about heavily for 10.5 months. We've known it's been here for a year approximately. How long do the antibodies last? That is now the real question because I have several patients that have contracted it twice. So essentially I was prefacing what I'm going to say now in that extrafollicular B cell maturation may yield more autoreactive B cells. COVID-19 and the autoantibodies. We want to take a moment with this. I know we're going at a rapid fire pace today, and I know we have some questions which I want to address at the end. So misguided immune response. This truly probably explains your long hauler issue. Patients producing autoantibodies. It's so reminiscent of lupus and rheumatoid arthritis. 52 patients who had severe or critical COVID. These were patients that had no history of autoimmunity. Half of them had autoimmune antibodies. Some autoantibodies were associated with blood flow problems. We talked a lot about in a previous webinar on blood vessel damage. So this autoantibody responded linked to COVID-19. So we all know that autoimmune disease is the self-destruction of its own cell. So to avoid autoimmune disease, we have to have B cells that undergo a training process. B cells that target your tissue are typically destroyed. You must have a maturation process. So if our immune system, the takeaway here, if our immune system is not functioning properly, we're going to race in with these B cells. When we race in with these B cells and they're not mature, they're not going to function at full capacity. It's sending a teenager to do an adult's work at this point, and our immune system will falter. So what you're going to have is these fast-acting antibodies, and they're called extrafollicular responses. They develop quickly, they're short-lived, and they die when more targeted responses emerge. When they don't, this is what you typically see. Lupus, severe COVID-19, rapid antibody response can cause a lot of self-damage. So our inability of our immune system to respond, this should not be a memo to everyone, appropriately leads you down a path of autoimmunity. So it's not just our body's overwrought, starts to attack ourselves through molecular mimicry. There's also this component of the antibody response is too immature, it's too fast, and it gets confused and damages tissues. So what about life after COVID-19 hospitalization? And yes, I've got my protocols coming. Everybody hang on. With 2 months of leaving the hospital, 7% of patients died. More than 10% of the patients were in the ICU, and 15 ended up coming back to the hospital. 2 months after hospitalization, 39% of patients got back to normal activities. That's 4 out of 10, obviously. 12 couldn't carry out basic care. 23 had shortness of breath climbing a flight of stairs. 1/3 had ongoing COVID symptoms. 26 had to work fewer hours, and 37 had minor financial impact. This was a compendium of 38 hospitals in Michigan of 1,250 patients. Here's another study that looked at most hospitalized COVID-19 patients have neurological symptoms. 509 patients. 82% developed problems from the neurological symptoms. Muscle pain was 45% of the patients, headache was 38%, altered brain function was 30, more severe brain issues were over 65 years. We know that that senior setting really leads them down a damaging path. And long haulers, it was defined here, those who continue to experience symptoms. 1 in 5 COVID patients had mental illness. 80,000 people were looked at in a study to see COVID-19 and Parkinson's disease. People with Parkinson's disease have a 30% higher death rate from COVID-19 than those without the neurological degenerative disease. Airlines, I'm flying this weekend. You know, I'm essential. I have to go give a presentation, social distanced and masked, people in the room. The research commissioned by the US found a risk of getting infected by airborne COVID on flights is low. They measured the dilution of the tracer particles on Boeing 767 and 77 aircrafts and found that aircraft's air filtration system got rid of the particles within 6 minutes. If only one patient is infected, it would take 54 hours for the other patients on board to get an infectious dose. My flights right now are 2 hours. So we're all afraid of the flying. The flying isn't the problem, would appear that the data indicates. It could be the closeness in possibly the airport or taking your mask off when you eat. Aspirin. Aspirin use may be associated with improved outcomes in hospitalized COVID-19 patients, and the results are really there. Taking an aspirin decreases your incidence in ICU admission and mechanical ventilation. So the real question is, as we get to the answer in the protocols, do we have a better answer? And I say we have a resounding yes. So let's look at the role of vitamin C, D, and selenium, basic supplements in immune system against COVID-19. The recent studies revealed that vitamin C and selenium deficiencies were evident in patients with acute respiratory tract infections. Vitamin D showed an improvement in the physical barrier against viruses. It was able to, vitamin D, stimulate the production of antimicrobial peptides, help prevent cytokine storms by reducing production of cytokines. Selenium enhances the function of cytotoxic effector cells. Vitamin C is antiviral, increases immunity. The administration of it actually increased the survival rate by attenuating excessive activation of immune response. It decreases the viral yield and reduces inflammatory responses and hyperactivation of immune cells. So let's look at these postulated mechanisms for vitamin C amelioration of COVID-19. Essentially, decreasing viral entry, increasing interferon production, decreases reactive oxygen species by also decreasing NF-kappa B, ultimately decreasing oxidative stress, increasing lung epithelial barrier. The coronavirus was shown that vitamin D reduces the infection and the impact of COVID-19. Patients older than 40 with sufficient levels of vitamin D were 51% less likely to die. So here we have the role of vitamin D regarding the ACE2 receptors in the response to SARS-CoV-2. By taking the vitamin D, you are able to avoid a severe COVID-19 disease. SARS-CoV-2 interacts with host ACE2 receptor sites in this PowerPoint slide using a spike protein S1 that facilitates the binding of the virion to the cell. Infection generates cytokine storm. ACE2 receptor expressing alveolar epithelial cells 2 help coronavirus replication. Essentially, here you're seeing that the SARS-CoV-2, again, a decreased damage when you're consuming vitamin D at the lung level. There's a busy slide, a lot of really good things going on there. Essentially, once again, and I mean, we could break this down and get in a granular situation here, but vitamin D spares the alveolar and the lung tissue damage through multiple signaling pathways. So here you have the positive and negative effects of vitamin D in immunomodulation against SARS-CoV-2. So when you go through this, this is more for a reference. Again, I want to get to the end. I want to get to some questions, but let's just take one segment of this. And I do recommend, you know, guys, I have no ego. Shut the sound off. Go through the slide deck after. There's a lot of time spent. There's a lot of data there. You're not going to get it on the first time. But when you're through with this, you're really going to understand, and you will then be able to elucidate to your patients why these protocols are so valuable to where they at, whatever phase they are in this health pandemic. So just let's take the inducing of ACE2 receptors. Vitamin D admission decreases inflammation, activates autophagy. Autophagy, that great ability to break down old cells, use that energy from the breakdown to allow for new rejuvenative or immune rejuvenation cells. Regulates the mitochondrial function, which is huge because, as I said earlier, coronavirus is a vampire to the mitochondria. It drains that battery, that energy system. It also induces immune tolerance. Immune tolerance is critical. You know, you eat a food, or you get hit by a pathogen, your immune system goes awry. You need that tolerance, you need that resilience, you need that support balance, if you will. So let's take a look, because this will really explain the basic nutrients and minerals that we recommend. The mechanism of action of micronutrients against SARS-CoV-2. You have nutrients, you have micronutrients, you have minerals, you have vitamins. Look at the minerals: zinc, iron, and selenium. Zinc is an antioxidant and halts the replication of SARS-CoV-2, targeting the ACE2 receptor sites. Iron activates the immune response by cytokine production, and selenium inhibits the ACE2 receptors. It's a strong antioxidant. Look at vitamin A. It's an upregulation of the immune system, anti-inflammatory. Vitamin B stops the replication of SARS-CoV-2, anti-inflammatory. Vitamin C, a potent antioxidant. Vitamin D, an immunomodulator, antimicrobial, and vitamin E, a great antioxidant, production of interleukin and natural killer cells. Maybe my favorite slide. I'm actually going to do a Facebook Live on this slide that you're looking at right now today. We're going to talk about the immune response and the inflammatory and innate immune response. Here you have vitamin A. Vitamin A is critical because it allows for the integrity of the epithelium. It also allows for the differentiation and the function of natural killer cells. Vitamin C. Again, this is a great reference. Vitamin C, in the citations in the right corner. Vitamin C is barrier integrity. It also helps with the scavenger of reactive oxygen species. Vitamin D has a production of antimicrobial peptides. It has, without question, a large number of positive health promoting effects. Zinc. Zinc is known, believe it or not, everybody talks about zinc because zinc is talked about in the idea of not only enzymatic reactions and a great antioxidant, it also is known to help with taste and smell. Omega-3 fatty acids, inhibition of cytokine production, structures of cell membranes. Now that's the innate immune system. That's the first part. Now we get to the adaptive immune system. The vitamin A has so many, they all have so many properties. You're taking the same thing again for different properties like the production of antibody. Vitamin C is allowing for T cell maturation. Vitamin D, again, with cytokines. Zinc. So they are so pleiotropic that they're able to be used throughout the process of innate and adaptive immune responses. The interesting thing, the one change, or the one suggested change, if it's an innate immune response, you want omega-3s. If you want to have a strong adaptive, a balanced immune response, that's when you add the pro-resolving mediators. So here you see the protective effect and therapeutic effects of macronutrients. Again, one of those slides to put in, look at all the different macronutrients and micronutrients. They're all in our protocols to really help decrease inflammatory pathways, especially those that are increased by an obese COVID-19 patients. Melatonin. Let me do this in a nice tight bow. Melatonin is great for sleep. It's shown to have great, outstanding effects even on COVID-19. It decreases inflammation, 3 grams if you are trying to prevent. When you have COVID, if you have it for the 10 days, let's say, 20 grams of melatonin. Food is our medicine for COVID-19. We've heard that before. Let food be our medicine, let medicine be our food. What we need to know now is we need a strong immune system because we have to deploy our immune system against pathogens. We want to have prevention, so we need more prevention now to lead to avoidance. An immune system depends on adequate nutrients to function properly. The unleveling of your immune system can come from your unleveling of macronutrients. Keep your carbohydrates, your simple carbohydrate consumption low. It has a immune suppressing effect. Air pollution, people don't realize, but air pollution is an issue. 15% of worldwide deaths from COVID-19 could be attributed to long-term exposure to air pollution. Once again, melatonin, great choice. It actually was associated with a reduction of the likelihood of testing positive for COVID-19. Vitamin D status, we've kind of talked about that before. 82% of hospitalized patients were vitamin D deficient. Enough said, as they say. Nitric oxide, great choice. NO has an anti-inflammatory effect, is a vasodilator, has antiviral properties. COVID-19, what you may look for in blood markers. People who exhibit the symptoms typically have an interleukin-6 elevation, which contribute to tissue damage, and a TNF-alpha that acts as an amplifier of inflammation. So here's my immune support supplements. Let's take a quick look as we hit the finish line. Vitamin C, zinc, mixed mushroom complex, vitamin D3 with K2, probiotics, NAC and liposomal glutathione, selenium, omega-3 fatty acids, elderberry, vitamin A. So here is your immune support supplements. Here is your protocol, what we were talking about. Vitamin C complex, it's ultra potent, multiform vitamin C blend for antioxidant support. It allows for support of healthy antioxidant stress and immune function, supports cognitive function, supports neuronal process, supports collagen synthesis, and supports healthy cortisol balance. interesting, there has been a research review, and just let me share you a whole bunch of different things with it. On this research review that Nutridyne has, Rob can get this to you. It speaks to the idea of using quercetin, American ginseng, elderberry. This is all that immune resilience. So to put it in a nice, tight sentence, immune resilience is what I rely on from myself, my family, my friends, and my patients to allow my immune system to be resilient. I take 3 tablets in the morning, 3 at night. This is your go-to starting point. The immune resilience has a cornucopia of different nutrients. You would, without question, want to add D3 with K2, because one of the things it does not have is D3 in it. So you're going already for immune resilience and vitamin D3. The Spore ProBio is a probiotic. We talked about that before. And look how important your gut and your gut health is. NAC 600, Zinc Pro, highly bioavailable chelated zinc, great for healthy immune function, DNA integrity, GI integrity, and increased appropriate gut barrier health. Liposomal glutathione, your master antioxidant. Glutathione, I like the liposomal because it's a nanoparticle that protects the glutathione, allows it to get through the stomach into its desired destination. Omega-3 fatty acids, we talked about it before. We really know that it's great for an innate immune system. And bacterial Sidex is very interesting in that it's got its echinacea, it's got elderberry, and it's got ginger, a great addition to boost your immune system. Here's your COVID-19 support. Here you have your quercetin and your NutriChecks once you have it. So that was to support to avoid. This is what you do if you're having COVID-19. So you're using your NutriChecks with support for healthy glutathione levels and detoxification. You add your brain support, which is a nutrient support for neurological function. And you have Nervies, which has got PEA and alpha lipoic acid, which is shown to be a synergistic combination to help with immune function. So quercetin, EGCG and turmeric, vitamin D, PEA, lipoic acid, zinc, and omega-3 fatty acids. Once again, immune support supplements if you have COVID-19 to support yourself. And if you're taking the vaccine, all good. Your decision, post-vaccine support, brain support, resveratrol plus, Inflamex Ease plus, sulforaphane complex, Omega Pure EPA DHA 2400, D3 5000 with K2, and pro-resolving mediators. What I'm going to do now, and this will probably surprise Rob, is I think we should have a quick post video. Maybe Rob and I can do 10 minutes where we really break these down, because this is really where you're going to be living for the next 6 to 9 months. So having said all of that, and I know I got a lot in that hour, we have questions coming up. Please keep an eye out. Rob just did a beta read for me, gave me some good reviews. I appreciate that. The Superhighway to Health, the 7 steps to optimizing the gut-brain connection, will be coming out in June. As Jim Rohn once said, take care of your body. It's the only place you have to live. I'm going to be answering questions, but I would like to imbue everybody with enthusiasm to join me on Facebook, Dr. Rob Silverman, or LinkedIn, Dr. Rob Silverman. Also, if you're interested in a laser group, there's my laser mastermind group. And we've got a couple of minutes. Rob, I'm going to bring you out. I know we had some questions.
I'm back. Can you hear me all right?
I can hear you fabulously.
Good. Okay, a few questions. Let's kick it off. So what is the function of alpha lipoic acid in the regenerate phase of the 7R protocol?
Okay, so I like alpha lipoic acid because there's a lot of data that indicates alpha lipoic acid is the only antioxidant that works with the water in a fat part of the cell. Studies have shown that it decreases the incidence of colitis and IBS.
Perfect. Does the virus get weaker over time moving from one host to another host?
What a great question. It appears, as we all know, viruses mutate. And where we're sitting right now, it appears that these different strains, so I'm in America, I think you guys had a strain, Brazil has a strain, and now they're talking about South Africa having a strain. By the way, they're all here now. So does it get weaker? The ultimate purpose of a virus is to live in the host and not kill the host, because it would die then. But some of these just with their variants, like HIV, was at one point extraordinarily deadly. So I don't know if it's getting weaker, but I do know that it's mutating.
Cool. In so-called long haulers, do you know if the effects are because of an inappropriate reaction to the immune system, or does it depend on other factors like genetics?
You know, I can see the question. So yes, yes, and yes. I do believe, first of all, I believe that our bodies haven't seen this virus. So it challenges our immune system. Even some healthy people have said they've been a little challenged. So it's something new. It's kind of like in life. You know, when you, oh yeah, that guy, you know, he complains every day for the last 10 years. It doesn't affect you. But if someone gets in your face and complains, and you've never had that before, like someone coming from New York, most people may react not to optimum. Same idea. Number two, genetics. Absolutely, they're genetic components. And three, wrong treatments. I think no treatment, wrong treatment. And I think one of the bigger overriding things is that our populations in the UK and North America, we're just not healthy. You know, we're so industrialized. We take our health for granted. People aren't exercising. We're not eating good foods. So I think all the above.
Perfect. And one last one. So we have the protocols, we have the lifestyle and nutrition recommendations. Say if you have a patient that comes in and they're really worried about getting it, would there be any tests? I know probably vitamin D3 straight off, but any clinical tests which you would run before starting anyone on a protocol to either to kind of determine what level of nutrients that they would be put on, or to see if anything else is underlying before you started a kind of prevention protocol treatment?
Absolutely. I've been running inflammatory markers. I've been running micronutrient levels, and I'm also testing gut health. Because think about this, if your gut's in its pristine condition, if your macronutrients are good, if you're not pre-inflamed, you're going to have a better chance. Plus, I'll be honest with you, I think you should run the antibodies now, because a lot of people have walked in, I would say not a lot, but I found that people had the antibodies to it and did, you know, they knew they had a flu, they said. You know, it's a 3 or 4 day flu versus really damaging. So I would run all those tests to really get an idea and reveal where that patient's health and immune system is.
Perfect. Well, thank you so much for your time today. Thank you for the webinar. We'll be back in a couple of months with Dr. Rob, and we'll be running a female health webinar, which I'm really looking forward to it. That'll be great. So thanks everyone again, and we'll see you soon.